am Belinda Davis, and I'm a registered nurse and child care health consultant, and I work with child care providers through the Quality First program here in Arizona, in the Pima County area. As Monica said, we're here to do hand washing, diapering, and sanitizing tonight. This is a big part of the environmental rating scale that you're graded on for Quality First. Quality First is basically a program for the First Things First program. And this is a way for us to improve the quality of childcare. That's what we're here to do, to improve the quality of things for the children. So basically, if we have healthy children, we have children who are able to learn better and to do better in life. We also know that when they're very small, that's when they're most vulnerable to diseases, and that's also when they learn the most too. So that's why it's important for us to have a really healthy environment. We know that if we're washing our hands properly, we cut down on infections. I mean, sometimes there's been some studies that say you can cut down on the disease within a facility by 80% by just hand washing at the appropriate times and washing the correct way. And so that's a concern that we have. We don't want diseases to be spread and things. So we don't want those diseases going home to the families either, let alone around the facility. And with diapering, the same thing. We don't want disease to be transmitted from the diapers.
Until there's bubbles.
Back of this until there's bubbles.
Back of this until there's bubbles.
In between, in between.
In between, in between.
In between till they're all clean.
In between till they're all clean.
Thumb, thumb, thumbkin clean.
Thumb, thumb, thumbkin clean.
Twist, twist, fingernail twist.
Twist, twist, fingernail twist.
Lastly, ring around the wrist.
Lastly, ring around the
This program is a Quality First program, and so through Quality First, we do have like a care plan that we have as child care health consultants, kind of known as our pathways. And so there's different health and safety issues that we want to cover, and in collaboration with the Quality First coach and with the center directors, we decide, all right, what do we want to work on here? Sometimes when we first come through, there may be some immediate things that we see need to be taken care of. Sometimes there are things in the community, maybe there's a pertussis outbreak or something going on in the area, and we may have to deal with that first. But then overall, we usually sit down as a group and collaborate on what issue do we want to work with. And pull the wipes out of it, right? So this is, even though we just cleaned it and sanitized, it's still considered to be germy. That's why we don't want...
So we grab it and we hold it and we pull up and pull them out?
If you had some other little table thing or something we could put them on, that'd be great. But we don't. So you really need to hold on to them and pull out however many you need. There's lots of health and safety trainings that we do. We might do something with SIDS or sudden infant death syndrome are one of the trainings that we do. We work with nutrition, playground safety, medication administration. There's just a whole bunch of things that we do with health and safety trainings. You name it. If you need that training and we don't have one, we'll create one for you.
It's not crying.
Let's go to clean. Okay. Well, it's a very gratifying job. I've been a child care health consultant for a little over 5 years now. And I just enjoy going out and visiting the programs and visiting the children and getting to know them and building relationships with them and seeing them grow and progress. So to the point that they're helping the children and they feel better about themselves and learning more and feeling that, they're doing a good job with what they're doing, and that's very gratifying.